Thank you, Ria. And just to sort of highlight what we're talking about, what we're going to really look at is stress. So we're going to look at the impact of stress on your health, various aspects of it, as well as some of the hidden sources of stress that you might not be aware of. And if you're feeling stressed, you're not alone. Even before the pandemic, we were in trouble. Over 50% of Canadians indicated that they're feeling moderate to severe levels of stress. And stress has been on the rise for the past decade by as much as 60%, a lot of that being attributed to technology. For a lot of people, stress is a result of having too much to do in too little time. Even retired people talk about this. And almost half of us realize that our stress is self-induced. We are our own worst enemies. The insurance companies have known this for a long time, since most of their disability claims are stress-related, and 75% of lost work time is stress-related and costs industry over $50 billion per year. Family doctors have known about this for a long time, since 50% of their visits are stress-related or psychologically related, in the sense that psychological factors, including stress, are worsening an underlying medical condition, are getting in the way of treatment. So what exactly are we talking about when we're talking about stress? Well, we're talking about the harmful physical and emotional responses that can happen when perceived or actual requirements of situations outstrip our coping abilities. Notice how perceived is highlighted. What that means is our appraisal of situations is probably worse than what the actual requirements are. That's why you can have two people exposed to the same situation, looking at it in very different ways and having consequently very different behavioral, emotional, and physiological responses to it. And when we look at sources of stress, one of the key ones are life events or changes. Too many changes occurring too soon. And when we talk about life change, we're not only talking about changes that are occurring at the moment, but even anticipated changes can impact us by getting the same physiological mechanisms in play. So for example, you might be laid off. You start thinking, will I ever be employed again? How will I feed my family? You have a heart attack and you wonder, will I be able to return to work? What will my future look like? All of that gets into play, all the kind of stress responses that we'll be touching on in a moment. Excessive demands, too much to do, too little time to do it, and not the resources, or not enough resources to really do a good job. And associated with this is what we call effort-reward imbalance, where you feel you're not being compensated enough either monetarily or through recognition. This is little constellation here is part of a key sort of component of work stress. Unjust treatment, unfair application of rules, or not in the spirit of the rule. With this kind of elicits a lot of anger responses. It also causes us to ruminate or rehash over things over and over. And that again gets all the physiological responses going. Personality styles. Let's talk about some stress-inducing personality styles. And when we talk about a personality style, we're not talking about an all or nothing type thing. You can have some type A or chronic worrier characteristics. It's neither yes, no, it's a matter of degree. So when we talk about the type A personality style, and some of you might have heard of this is the high drive, impatient, status conscious, slightly irritable individual that gives 110% all the time. I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. This personality style was actually kind of discovered and worked up by a cardiologist, not a psychologist, because what he noticed is that people showing these characteristics had double the risk of developing cardiovascular disease. Recent research tempers that correlation, but it's still quite high. And again, this is a person that goes till it's detrimental to their health. The chronic worrier, the what if person. This person is constantly analyzing, overanalyzing situations, often employing what we call a worst case scenario type of thinking. What can go wrong will go wrong. Consequently, they're in a constant state of anxiety, apprehension, Change is difficult. Coping with challenges becomes more arduous than it needs to be. A kind of magnified version of this is generalized anxiety disorder. The perfectionist. Some of you might know this person. So perfectionism is associated with depression. And part of the reason here is that perfectionists never really get to savor, the fruits of their labors because it's never good enough. They also tend to set unrealistic goals for themselves that they can never accomplish. Consequently, there's always kind of a negative aspect to their life. They also tend to be hypercritical of others as well as themselves, which can lead to interpersonal stress. And people living with perfectionists also can be stressed out, where you see now a cascading effect occurring. The negativist. This is the doom and gloom sayer. This is the person that looks at the weaknesses and failures in themselves and others. When you ask them about their past, they say it was bad. You ask them about the present, not good. Future, bleak. Constantly in a pessimistic mode. Change is frightening. So if you've ever had one of these negativists in a work situation and you've had a new kind of maybe job initiative, they're the folks that say won't work. So any changes that need to be made in their life really become extremely difficult and stressful. Unmet personal needs is another common source of stress. Esteem needs. We all have a need to feel worthwhile and purposeful. And if that doesn't happen, that creates a kind of a distress, discouragement to us that, again, gets a lot of the kind of physical correlates in play. Affiliation needs. We need to be part of a group or have some core supports with us, usually 2 or 3. When we talk about COVID-19, this is one that's greatly impacted. Having no or little control. We don't have a target for action or coping. So we can't be the masters of our own fate. Highly stressful. Social isolation relates to those affiliation needs. We are social animals by nature. And then there's mind traps, stress-inducing thought patterns, inaccurate ways of thinking that make our life a lot more stressful than it needs to be. I'm going to touch on 2 very common ones. We kind of alluded to them earlier with the personality styles. Catastrophic thinking. This is where minor mishaps or problems are viewed as crises. Low probability negative outcomes become high probability in our head. The spot on our hand becomes skin cancer. A call from the doctor's office, something bad's going to happen. So people with using this style of thinking are in almost a chronic state of anxiety, constantly on guard. Negative filtered thinking. This is where we focus on what's going wrong, ignore what's going right. And when something goes wrong, we tend to maximize it by attributing it to internal factors, such as our skill sets, intelligence, so forth. If something goes right, we tend to minimize it by saying it's due to external factors. It was just luck, it was easy, anyone can do it. The stress response, in terms of how it impacts our health, the seminal research was done by a Canadian physiologist, Hans Selye. And what he found is that the body prepares itself physiologically for change, which makes sense. So he said that's an adaptive function. He called it the general adaptation syndrome. What he started to find is that when the changes were too frequent or too long or protracted, animals started getting sick. So the eustress or adaptive stress now became distress because demands overwhelmed the coping resources. The physiological on button was on for too long, and organ systems and physiological systems couldn't handle it. So in some respects, if we look at this as the old design, it's kind of engineered for acute short-term stress. Chronic stress is the killer, and you might have heard the term chronic stress kills. The stresses of modern day life, for most of us, as we just looked at, are mostly psychological nature, which means they tend to drag on and on. So in a way, there's a built-in aspect that sort of leans them towards chronic. So here is what the old design, as I'm going to call it, what Selye was talking about, is all about. Saber-toothed tiger, fight or flight response. Probably that caveman's blood pressure, heart rate, platelets, for clotting factors going up. But how long does it last? A few minutes. That's it. When we look at common psychological stressors, the stressors of modern day life, interpersonal stress, work stress, these situations are part of our lives on an ongoing basis. And even if we leave the room or leave the situation, they live on in our head. So with these two individuals, they could leave the room, but they're thinking about how the other person mistreated them, was disrespectful. And with that, the physiological sort of fight-flight response is still in play. The person on the right can leave work, but goes home, thinks of how they're unjustly treated, work demands are too great, and again, the stress lives on. This is a pretty complex slide, but this really highlights the basis of how stress affects your health. So we said chronic stress is a culprit. And what happens with chronic stress is brain systems like your sympathetic nervous system, which is the emergency nervous system, kicks in. Your hypothalamus in your brain has a lot of hormonal responses to also deal with that stress response. We also see with chronic stress is that makes it vulnerable for you to develop mood or anxiety disorders. So if we look at that box with the brain systems and the poor lifestyle that often accompanies stress, we go to old bad habits, ingesting calorically dense or fat foods, smoking, drinking, sedentary lifestyle. And when you combine that with the brain system effects, you see a whole host of physiological variables come into play. Blood pressure with hypertension, platelets with clotting factors go up, which if there aren't wounds to plug, your arteries get clogged up. Various systems that control cholesterol and blood sugar levels come into play, where everything gets elevated, so that over time, health outcomes get worse. And the unfortunate thing is that the more chronic stress we have, our reactivity to stressors becomes a lot more intense. We react sooner and with a more intense reaction in our brain systems, our lifestyle, and consequently all the physiological correlates. Here we have an outline for depression, and depression is a cardiovascular risk factor like hypertension. And we see that how we think and how we feel up there where it says stress in the limbic system, there's neurophysiological electrical impulses going out to every major organ system, as well as chemical impulses through the hypothalamus. We are connected neurophysiologically, electrically, as well as hormonally. It's in your head, but it's not imaginary, it's real. So what we're talking about when we look at the stressors that we've touched on with the sources and the psychological stressors in general is it's putting you in the red zone for too long. And this is, if we use the car analogy, you're okay for a little bit with revving RPMs. But if you're there for 15 or 20 minutes, guess what happens? Things break down. So what you're about to sort of hear is stressful. Some of you might have come here to reduce stress levels, anxiety. Actually, I'm giving you the warning, what you might hear now is going to increase them. So when we look at the cardiovascular system, kind of just to summarize what was kind of alluded to, negative emotional states increase your risk of hypertension, diabetes, cholesterol problems. With your platelets, your clotting factors going up, and when you combine all three of those, you see that your risk of clogged arteries in terms of the rate at which it occurs and the rate of progression goes up. And this is from prospective studies. Your heart doesn't work as well. And what can happen in some individuals is their coronary heart arteries, instead of opening up, actually constrict. They narrow and close with constriction. And that can result in a heart attack. Well, McMaster University in Hamilton has found that psychological factors are in the top 3 or 4 contributors to heart disease worldwide, doubling your risk of a heart event. Depression, we said, is a risk factor. Anxiety and hostility soon to follow. And when we look at psychological factors and their impact on your health, they follow what we call a dose-response relationship, meaning the more stressed, more depressed, anxious you are, greater likelihood of negative health outcomes. And when we look at people who are vulnerable because they've already had a cardiac event, we notice that their survivability can go down with depression and anxiety. So here we have survivability curves for cardiac patients related to depression. The BDI scores looks at depression, low scores of less than 5. 95% of people survive over 5 years. When it goes down, when we get more severe levels of depression, scores of 19 or greater, only 75% of people survive over 5 years. And this is with other risk factors being controlled for, just looking at depression. So which curve do you want to be on? The other interesting thing is as depression goes down, survivability goes up. The immune system. So chronic stress has been related with immune cell activity, T lymphocytes. And what's been shown is that your susceptibility to common cold viruses in general goes up with that dose-response relationship. Healing times of wounds take longer. Duration of infectious illnesses longer. Antibody responses to vaccines goes down. In fact, Great Britain had done a lot of research on this with flu vaccines, and they noticed that highly stressed people did not have as good antibody response, and now they're looking at COVID-19 vaccines. Cancer relapses go up, MS attacks, HIV to AIDS, and what we find is that DNA repair mechanisms for abnormal cells aren't as good. They can't identify the abnormal cell or send out killer cells to get rid of it. And, when we look at the immune system, it declines with age, and we got a lot of that with COVID-19 being highlighted. What stress does, it accelerates the decline in the immune system. And just for illustration purposes, have you ever seen a kind of a friend that's had a stressful period in their life and they look like they've aged prematurely? Barack Obama is another example. Musculoskeletal, gastrointestinal systems, muscle contraction, tension headaches, you probably are familiar with that. Hormones related to pain increase, so pain increases, especially with chronic pain. Stomach acids and intestinal motility goes up, so IBS, Crohn's systems also increase. And we know that psychological treatments such as cognitive behavioral therapy, relaxation, mindfulness can help in these matters. So what do we do about this now that I stressed you out? Well, let's look at some mind-body health prescriptions. First one, let's know the enemy. Most of us do not realize how stressed out we are. We almost tend to downplay it. In our society, it's almost taboo to indicate that you're feeling stressed. Have you ever looked at a stressed out friend and said you're worried about them? The most common response you get is, I'm fine, don't worry about it. But ignorance is not bliss. We know that even if you're unaware of your stress responses, your body physiologically is still reacting. You can tell yourself you're okay, but the body is on physiologically. So let's look at some of the warning signs. And the goal here with this tip is for you to know when you're ramping up stress-wise and look at the situations where that's occurring so that you can prepare yourself to deal with those situations a lot more effectively. So when we look at the physical warning signs, we see that you can have responses in any of the major domains of physical functioning: musculoskeletal, cardiorespiratory, gastrointestinal, neurological. Everyone's a little different. We all have our own particular weak physical system. For me, it's the gastrointestinal system. If you have cardiorespiratory, get it checked out. Don't assume it's stress all the time. Make sure it's not an underlying cardiovascular condition. The emotional warning signs, I'm sure we're all familiar with those, where we're feeling overwhelmed a lot. What used to be simple now becomes an arduous task. We get emotional exhaustion, always kind of like edgy, pessimistic. We don't feel depressed, but we might feel blah. We might suffer from presenteeism, and what that means is you're physically there, but mentally you're somewhere else. People say, hey, where are you? You're not home, and you're inaccessible to your loved ones. What's happening there is you're preoccupied with some of those other stressors that were talked about, so you're not in the moment. Irritability is common, and some of you might notice that when you're stressed out, you begin to doubt yourself and your abilities. Because remember, stress is a survivability response, and we want it to be up to snuff. One good indicator of this is checking behavior. You might notice that you check the stove more often, check the door, check your calculations, check your spelling, checking behavior. The cognitive warning signs of stress: concentration drops, your memory for new information especially is affected, errors go up, you can't make decisions, they all begin to look equally bad. Problem solving, you say, oh, my mind is like sludge. And some of you might develop what I call a tunnel vision, where you begin to focus on minutia in irrelevant details, and you're not looking at the big picture. You can't see the forest from the trees. The social warning signs of stress: people become too much work, so you withdraw. Or you might develop what we call an interpersonal sensitivity. That is where you personalize things more than you need to, and then you become confrontational. Or you might need more reassurance and become dependent on others more than usual. Many of you will notice a decrease in your empathy, your ability to put yourself feeling wise in other people's shoes. What's happening here is you're more self-focused. I say don't feel guilty. That's part of the stress response. And since you feel vulnerable, you're saving the host organism first. The analogy is like, bring the air mask to your face in a plane if it's dropping in altitude before giving it to someone else, because by you surviving, others later could be better off also. The behavioral warning signs are as varied as people that are watching this webinar. Some of you are nail biters or donut bingers. Some of you have an extra glass of wine or two. Maybe they're smokers, ex-smokers, impulsive spending. You tend to be late for things more often. There's an increase in vegging out activities, the prime ones being TV, Facebooking, and Netflix binging. You neglect breaks because, given that your efficiency has dropped off, you try to make up for it at lunch, making matters worse. And productivity goes down. We know with the stress and anxiety that a little bit actually cranks up your performance, but then you reach a point where everything plummets, the numb out spot. Tip number 2, self-care. And I want to highlight here that a lot of people suffer from self-care guilt. They don't want to take the time, or they feel reluctant to take the time to do some of the things we're talking about in these tips because they feel they're being selfish. And I say it's only sensible to take the time, because if you go down the tubes, a lot of the people that you're worrying about are going to go down with you because they depend on you. So self-care and arousal reduction, do's and don'ts. Breaks are important. Marathon schedule puts you on a burnout. Relaxation strategies like abdominal breathing, progressive muscle relaxation, meditation, mindfulness, really good. Alcohol, drugs, junk food, bad idea, and actually raises your arousal level. We know that exercise is good for stress and arousal reduction down the road. Venting is bad. Even though a long, long time ago, therapists talked about venting is good, we know with recent research in the past few decades, it's actually detrimental. For example, when you vent, think about it. What happens to your arousal level? It goes up. Also, what we noticed from our diagram earlier is that when your arousal level is up and you're stressed, you're more likely to look at subsequent things across the radar screen in a more stressful, magnified fashion. Music is good. I don't know if heavy metal makes the list, because my rule of thumb is if it's bad for plants, it's bad for you. Coffee is on the don't list because of stimulant properties. So a lot of things with stimulants, of course, increase your arousal level. Social supports are really important. So nonpartisan friends, people who show you the pros and cons, that's a good kind of self-care arousal reduction strategy. Toxic friends, on the other hand, are a bad idea. And what is a toxic friend? Well, you'll know them because what they tend to do is they tell you how your situation's a lot worse than you anticipated, or they try to one-up you. Thing is, you'll leave a meeting with a toxic friend a lot more distressed. Light reading, binging is bad because we don't binge on carrot and celery sticks. We tend to go to calorically sodium-dense foods. Humor is good. Stewing and rehashing the saber-toothed tiger is drooling over you. And we know how important sleep is. Tip number 3, combating the negativity bias. We are inherently look at small negatives in our life, most of us. So the person with 20 items in the 16-item checkout, or all red lights going to work, we note those. We ignore the small positives that are going on. So first thing is recognize that bias. Second thing, get those arousal reduction techniques going and mindfulness moments. Because if your arousal level is down, as we talked about earlier, your tendency to give negative interpretations to subsequent challenges goes down. A gratitude list, like what is going well in your life right now or has recently. Keep that in perspective. Focus on accomplishments and completions, not on incompletion and unsuccessful efforts. We know from Gestalt psychology that, again, we have this inherent bias to look at incompletions and things that don't go well. Let's reverse that. And let's talk about the mind traps for stress, ways of addressing them. So when we look at catastrophic thinking, one good way is to develop a written evidence list of information that counteracts those negative thoughts. So if it's a call from the doctor's office and you're thinking of something bad, we'll say, no, he's called before, telling that mostly because appointments had to be rescheduled. In terms of how am I doing physically, all my kind of test results are good, my energy levels are up. So written evidence, and I stress written, or you can dictate it into your smartphone, is that when you're into a negative mood state, you won't remember these things. And what happens is you'll just focus on other negative aspects. Mind reading. Mind reading is something that we all do of other people's actions, especially if those actions are a little ambiguous. And what you might notice is that you mind read in a negative direction. Those people don't like you, they're saying bad things about you, so forth. So to counteract that, assume nothing and ask clarifying questions. Most often you'll find is that it's not negative aspects about you, or maybe they're even giving you very little thought, actually. And for negative filtered thinking, I want you to start looking at a small plus diary. And what I mean by the small plus diary is note the small joys in your life. Anything that brings a smile to your face, a chuckle, or lightens a load. Take a mindful moment to let the joy sink in. Record them as soon as possible before that negative wave sets in and makes them difficult to access. And review that sort of at the end of the day. And again, dictating into the notes section of your smartphone is a very quick way of doing that, very effortless way of doing it. We can learn from optimists. So optimists generally recover better from stressful events, including illnesses. They have a greater sense of well-being and a better quality of life. So what do optimists do that we can learn from behaviorally? We can't change you into one, but we can learn from their behaviors. Well, what they do, if they know the challenge is coming up, they prepare for it. They're proactive. They don't take a passive stance. They engage in problem solving instead of being emotionally focused, dwelling and wallowing in sorrow. They do effective goal setting. They break up big tasks into smaller ones that are achievable. When the going gets rough, they put effort and persistence. They don't readily give up like pessimists. They accept reality as opposed to pessimists who engage in denial and escapist behaviors such as procrastination, alcohol, drug abuse, so forth. They do put a positive thing on spin on things, but they don't engage in catastrophic thinking like we would talk about. And the thing is, have you ever tried to give feedback or constructive support to a pessimist? They tell you, I don't want to hear it, just hear my pain. In contrast, optimists use your support and feedback constructively, getting better outcomes. They also learn from adversity. Pessimists, adversity is always a disaster. They try to forget about it. and consequently keep repeating the same mistakes over and over. Develop realistic expectations and avoid the comparisons hook. So here I show you why I went into clinical psychology, not art. These are my mountain climbers. And the thing is, when you look at realistic expectations, you've got to look at the load that you're carrying at a particular moment, the size of your backpack. There could be a lot of factors going on in your life at a particular moment in time that make a challenge maybe more difficult than what it was in the past. So you have to gauge your expectations to that. So for example, if you've had a major health event, you might not do as much as you could before because, as you see with the person on the right, your backpack is full because of all the changes that have occurred with the event. And when we make our comparisons to other people, again, we tend to set ourselves up for a negative outcome because what we tend to do is compare our weaknesses to other people's strengths because that's what attracts us about those people, their successes, how well they cope. And that sets us up for feeling like a failure. And in the process, we're probably not looking at whether their backpack is light like that person at the top or whether it's over full, whether it's full to the brim like the person on the left who might more represent our situation. Tip number 4, develop a more diversified sense of self. And what I mean by that is when you look at your identity, realize that there's many elements to it and nurture those elements by taking the time, both by engaging in the role and thinking about it to make sure they expand. And the reason why you want to have a more kind of diversified identity is that if any one of those areas gets compromised by major challenges, disease, unemployment, you have other areas to look at. Your identity doesn't go down the tubes with it. For a lot of us, we develop constricted senses of self, where we put all our eggs of identity into one basket, often work. So if we get unemployed or if something happens at work, we get a lot greater stress response. And if you notice, by having that sort of constricted self, a lot of those other areas that we had earlier have either disappeared or shrunk. And that's what often happens. And often when people go into retirement, they go, what's next? Because they haven't nurtured those other aspects of self. When we get sick, the physical comes to the forefront, where we live and breathe a disease. And we don't realize we're more than just our bodies. I want to talk a little bit before ending about COVID-19, which is a perfect storm of stressors when you think about it. It's a hidden stressor. First of all, where is it? It's everybody. It's everywhere, and now it's become prolonged. Consequently, our sense of control now is jeopardized, which we just talked about is a major source of stress. So consequently, our emergency nervous system, that sympathetic nervous system, and our hypothalamus, it's on almost constantly. Maybe not at full tilt, but even just slightly, which results in fatigue, and as we discussed earlier, hyperreactivity, and any subsequent stressors in our life. Our daily activities take a lot more effort. When we're in stores, we gotta navigate, worried about people being too close. We gotta make sure our mask is on. We gotta make sure to sanitize. Life is a lot more work. And with restrictions, and I guess more restrictions that was just announced, isolation, another kind of source of stress that we talked about, and the removal of common coping resources now are in play, such as social supports, structured exercise programs. And with COVID-19, it's not only ourselves that gets highlighted that's in jeopardy, but also our loved ones, colleagues are in danger, magnifying the effect. So what we see are that rates of depression, generalized anxiety disorder, obsessive compulsive disorder, PTSD, substance and alcohol abuse up 40%, all deal. But we talked about some tips. You can use that for dealing with COVID-19. The gratitude list, the evidence list, that if you use your risk mitigation behaviors, along with if you got the vaccine, the probability of you getting it is a lot less. Also limit exposure to newscasts from unverified sources. And I say once a day is all you need to know about what's happening with the COVID-19 situation. Keep up social contacts through virtual means. So we've come to the end of our journey here. And again, just to recap, hopefully you got a little more information on sources of stress, some tips of dealing with it, and the link between how your mind affects your health.
Thanks, George. There was one question, and I think I'll put it in general terms. Maybe it's a little easier to answer, but it relates to maybe a fear of a repeat event. So maybe it was a heart attack, or maybe it's a repeat diagnosis for cancer, or any kind of repeat, I guess, like negative impact on your health. How do you suggest one handles that?
Yeah, so often what can happen is that you go to that catastrophic thinking, where you look at the worst case scenario. So if you look at what's the evidence approach, so what are doctors' results saying? Am I doing the lifestyle changes and adhering to the medication regimens that are evidence-based to prevent that from happening? That should hopefully lower the anxiety, along with a lot of kind of relaxation, arousal reduction procedures that we kind of alluded to in that tip.
Good, thanks. That was the one question we had that came up during. If anybody has any other questions or comments, you again can use the chat box. I think there was a lot of really good information there that we can apply in all different scenarios. So I found as I was listening, I thought, yeah, that applies here and that applies here, and I can kind of use all those techniques. So remember, if you wanted to rewatch this talk, you can always go to our website. So if you wanted to re-listen to it or write or jot notes down or anything like that, by all means. I think there's so much information in this one, we might want to rewatch it just to catch some of it. Yeah, there's a few messages from people just saying thank you. So I think everybody's just absorbing all the good information. George, thanks for that. I'll give everybody a couple more minutes. Oh, there's one comment here. Just a thank you for the great tips about COVID. It's not hard to get discouraged with the increasing restrictions, but thanks. And yeah, we're dealing with that daily. Everybody's dealing with that. I was talking to George before this, how there's new restrictions. So this talk was very timely, I'm sure, as we're all feeling a little bit more stressed out as to how we're going to deal with things. So hopefully we can all deal with it together and kind of get through this weird time we're living in, I'll say. If anybody has any other comments, I'll give you a minute or two. Otherwise, maybe what I will do is wish everybody a safe and happy weekend, and hopefully you stay with just your loved ones as the new restrictions are laying out. You can always visit our Reh-Fit anywhere. If you want to do some exercise, if you wanted to rewatch one of the talks that we had and get a little bit more information. And next week, Wednesday, we're coming to an end for our Fit Talks for the season. We'll let you enjoy a break for summer. It's Dr. Justin Cloutier. Hopefully I said that right. It's nutrition and cardiovascular health. What is a heart healthy diet anyways? So we'll look at some of the details on that. And that's next week, Wednesday, same time, 7 o'clock. So it's great seeing everybody with your cameras on. Hi, Jan, everybody that I see there. And we will hopefully be back and running shortly. So keep staying active, because you know it's good in all aspects of your life. And I will wish everybody a nice, happy weekend. And thanks again, George.
Thank you, Rhea.
Thanks.
Thank you for attending.
Good night, everyone.
Night.